Hey everyone. Today we are going to discuss about temporary filling and its uses. A temporary filling is a temporary treatment meant to protect a damaged tooth until a more permanent option is available. Need for a temporary filling. Prevents reinfection, acts as a barrier, preventing bacteria from re-entering the tooth after treatment. Tooth damage, protects the tooth from external factors like temperature changes, pressure from chewing, and accidental trauma. Without this protection, the tooth is more vulnerable to cracking, breaking, or further decay. Food impaction and sensitivity. A temporary filling prevents food from getting stuck in the treated area, which can cause discomfort and increase the risk of further decay. Protecting and providing a cushion against external stimuli like temperature changes and thereby reducing sensitivity. Supports healing. It provides a stable environment for an operated tooth to recover post-treatment. Introducing Maarc T-Fill, a pre-mixed moisture setting, ready to use, temporary restorative cement for filling and sealing. It is CE certified and conforms to European standards. T-Fill comes in 2 pack sizes, 40 grams and 30 grams. It comes in mint, bubblegum and strawberry flavor. Let's talk about the ingredients of Maarc T-Fill. Number 1 is calcium sulfate. Calcium sulfate hardens with hygroscopic chemical reaction with moisture in saliva and swells slightly and expands to create a tight seal against tooth structure in which it is filled. Zinc sulfate, being hygroscopic, is moisture setting and adds radiopacity. Barium sulfate, adds radiopacity. Zinc oxide, imparts antimicrobial properties to inhibit bacterial growth in the area and is biocompatible. Fillers, binders, excipients, coloring and flavoring agents. Properties and features. It's eugenol-free and does not cause any irritation and sensitivity. Micronized with even grain size, thereby homogeneously mixed for grain-free consistency. Non-sticky to instrument. High adhesion to tooth structure internally. Undergoes hygroscopic even expansion by absorbing moisture in oral cavity, leading to efficient adaptation in irregular and microspaces in tooth cavity, pushing against tooth walls, creating a tight seal and adhesion to teeth structure, ensuring no further penetration of oral fluids and bacteria in tooth cavity. Quick setting in moist conditions. No cracks, even expansion due to even grain size. Pleasant flavor and neutral taste: mint, bubblegum and strawberry. Packed to ensure minimum moisture contamination, dual cap for air sealing. Easily removed from the cavity. Now let's take a look at the indications. For use as temporary filling material after endodontic treatment in class 1, 2, 3, 5 cavity. For use as temporary inlay material. To seal the cavity between visit in multiple appointment root canal treatment. Instruction for use. Clean the cavity with cotton pellet. Take out the required amount of material from the container using a filling instrument. Pack the material in the cavity or make a ball of it and pack it in the cavity. Wipe the extra material with wet cotton pellet. Check the occlusion to ensure that there are no high points. Refrigerate, not freeze. Once opened, it helps to cover seasonal humidity and temperature fluctuations. Now, let's break the myth of identifying a good temporary filling material.
The temporary filling material Maarc T-Fill from Maarc Dental is very bad. I used only half of it, and it's set in the container.
I also use the same, and I feel it's very good.
Why do you say so?
Temporary filling materials set once exposed to moisture from hands, tools, or humidity in the air. Closing the lid tightly post-usage and refrigerating in a cool and dry place ensures the utility of most moisture-setting temporary filling materials over their entire balance shelf life.
I understand proper storage would be beneficial, but that does not make it a good material.
A quick-setting temporary filling material ensures a hard set across all dimensions versus slow-set ones that become prone to microleakage and microbial contamination during the setting phase in an oral cavity. But quick-setting temporary material needs to be more carefully handled and stored, and is prone to setting in a container than the slow-setting one.
There are other brands which does not set in the container, but I think they set in the oral cavity, I suppose.
A temporary filling material is efficiently set only if it has not chipped off or reduced on any dimension when the patient comes back and you have to scrap it out and it's hard.
Oh, okay. But the one I use is reduced in size and comes out of teeth easily. Do you mean it is not setting hard to correct protective stage and across dimensions?
Yes. Microbial contamination in such cases can lead to teeth complications, retreatments, and can give a mass blow to our reputation. I would prefer using material that has higher sensitivity to moisture and ensures effective setting across all dimensions once filled in the cavity, including depth versus the one which is slow set.
Oh, I get it now. I will use the one you are using and refrigerate and store it appropriately to use it over the balanced shelf life. Switch to using Maarc T-Fill. Thanks for watching.